Can I? Hello, everyone. My name is Dr. Aditya Gupta. I'm currently doing my DA in Pediatric Oncology from AIIMS New Delhi. Today, I have the pleasure of with me Dr. Ashwin. Dr. Ashwin did his MBBS from Russia. Following clearing his foreign medical graduate entrance examination, he cracked the AIIMS PG entrance examination and is now pursuing his MD in Geriatric Medicine. He's a final year Geriatric Medicine resident here at AIIMS Delhi. So, with a brief introduction about him, that I hopefully this clears a lot of doubts for people, for medical graduates, that whether you can or cannot clear AIIMS. Yes, you absolutely can. I have a live example. I have inspiring figure right in front of me right now. Hi to Dr. Ashwin. How are you?
Hi Aditya, it's great to talk to you one-on-one, especially.
Yeah,
I'm good. How are you?
I'm okay. I'm great. Enjoying my Sunday off finally. So, yeah. Dr. Ashwin is pursuing his final year of his residency in geriatric medicine. Now, geriatric medicine as a branch is something which a lot of people don't know about, or if they don't know about, they do tend to have a lot of doubts. So I just had this session with him, so we can clear those doubts. We can have a conversation with him on what geriatric medicine is, what it entails, and if blah blah. So I'll just begin. So Ashwin, just tell me what geriatric medicine is about. What is the residency like, and anything that else you want to add on?
Definition of geriatric medicine is kind of straightforward. It is a medical specialty, especially for the elderly. So usually in AIIMS, we see people over the age of 60 years in OPDs, and those are our patients. So geriatric medicine is basically a specialty on that. So these are the kind of patients that we get with a lot of comorbidities, multimorbidities, we say, right? So we deal with a lot of chronic diseases. So it entails it is a broad specialty that entails different subspecialties put together. So you need to have a broad aspect. It's basically, I would say, an internal medicine with a geriatric focus. So internal medicine for the elderly, that is a way of telling what geriatric medicine is, but that is much more than meets the eye, what geriatric medicine actually means. So that one has to experience it.
Fair enough. So basically, geriatric medicine is essentially a broad specialty of medicine, specifically concerned with the care of the elderly of more than 60 years of age.
Yes.
Yeah, as far as the AIIMS is concerned.
I have to add here, the thing is right now, the population, the growing population, right? We are kind of demographics. There are a lot of elderly population. Currently, I think it's about 10%. By 2030, it's going to be 13%. And currently, they say there is a WHO report that says that there are more elderly population now than children under the age of 5 years. And by 2030, that's going to be like, there is more elderly than children under the age of 10 years. That means it's 194 million elderly versus 183 million children. And by 2050, it's going to be 2.24 billion elderly in the world. So that comprises of 20%.
So basically what Dr. Ashwin is trying to say, that in a country like India, in our country, the demographics are rapidly changing. Instead of having what we read in PSM, that typical triangle shaped graph, it's becoming that bell shaped graph with elderly increasing in the population. And as a result, we do require specialized care for the elderly, which geriatric medicine provides, especially considering the fact that they do deal with a lot of comorbidities, and the specialized care is provided by geriatric medicine. It's a broad specialty. Now, how is geriatric medicine as a residency?
As a residency, it's very satisfying. The thing is, you get patients with a lot of comorbidities. Every time, like let's say they come to your OPD with a lot of their problems, and there is a psychological aspect to their problems too. So every time have a conversation with them, you kind of have this time travel kind of feeling, because they bring their heydays, the time they were good at. So that is one good aspect about it. You get to meet people of different ages. And when you're dealing with their comorbidities, the very fact that you're talking with them for a prolonged conversation, because most of these elderlies that come to you some of them are neglected by their family members, and some have little chronic disease. They just want someone to talk to. So in addition to treating their condition, you're having a very good conversation with them. So at the first step, you are curing by, I wouldn't say cure per se, it's like you're healing in a way by giving your, 2 cents about their lives, and you learn a lot from them. That is what I'm telling. Yeah, that's a good thing about residency, and it entails all the procedures that you do in internal medicine, the ICU thing, which I will have to talk more in detail. So you can ask me anything, because I'm going to show you what is going on right now. We have this National Center of Aging. The very reason why I'm in the car right now is I'm right close to it, and my hostel is behind. I just want.
You can show it to the
Oh, okay, sure.
yeah, definitely.
Yeah. I'm really proud about that.
Yeah.
The thing is,
so AIIMS right now is building a dedicated center called National Center of Aging (NCA), and it's being built, if I'm not wrong, at MMC at Madras Medical College as well.
Yes, Madras Medical College also has, but nothing's close to this. This is second to none, I would say.
Yeah,
this is the best building. It's like 10 floors. Okay, you see that building, right? It's state of the art, high-rise building.
The plan of AIIMS, if I'm not wrong, the national plan involves creating these centers at a state level on almost every state, with AIIMS being the center support. So this is a huge building, see, and
it is a huge building. It's 10 floors. Yeah,
exactly. So,
I would say more about it. The thing is, there are 10 floors here. It's a they're trying to this is going to come to fruition by Jan of next year. That is for sure. That is what they are telling right now. And it's going to be 200 bedded general ward beds with 20 ICU beds and 10 post-op and 10 pre-op care with ICU beds as well, and private wards included. So it's more or less, let's say, 300 beds in total. So they are going to employ people in geriatric anesthesia, geriatric surgery, and other subspecialty. It's poised for more growth. You understand? More people, more subspecialty that's going to develop.
I can understand it as us being a pediatrician. I can myself understand this. Like earlier, even pediatric was the medicine only. People used to children do as a specialty. And now I'm doing a DM in pediatric oncology right now. So it's the same as far as medicine is concerned. The care of the elderly, the care of their specialized need has now got a different branch. And that branch is growing very rapidly, as we can see from the video that you just showed to us, that amazing 10-story store. So we have in AIIMS a mother and child block for gynecology and pediatrics. And at the same point of time, we have a block just for the care of the elderly. And this something similar to this, obviously nothing will compare to AIIMS probably, most likely, but similar setups and similar infrastructure for the care of the elderly is coming up in a big way all over the country. And residency, as Dr. Ashwin has said, that is probably the one great thing, and is very satisfying. And can I delve a bit more about? A lot of people think that geriatric medicine is just treating the comorbidities, but as you said, this involves a lot of procedures in ICU. Can you just elaborate on that as well?
So I'll tell you what we do in our ICU. So right now we have a HDU where it works more on a ICU level. This building I'm talking about, this has a full-fledged ICU that will be managed by anesthetists and geriatric medicine people in coalition. So so far what we are doing right now, we do ICD, we do intubate, ventilation, we do put them on ventilation. Then apart from that, pleural tap, the procedures, the emergency procedures, the procedures to relieve their symptoms. We do everything that is going on. It's not like it's just an OPD basis that you do. You do the procedure for critical care people. You do all the sort of procedures that is very important for their good outcome. And in addition to that, we have a psychiatrist working with us, psychologists and psychiatrists. So we have special clinics like dementia clinic, that is memory clinic. So, and that focuses more on the caretakers as well, because they have this caretaker burden. And I wanted to add this as well. Dementia is going to be the future for it. Since we are a growing population, dementia is a big concern, and we are trying to put steps ahead to, for residents to develop their skills, to, get it from the, take it from the initial aspect, like control it, and how to go about managing it well. That also entails taking care of the people that care for the elderly. So it's a very holistic, family-oriented view that you have, and you're managing the family as a whole. That is one kind of a satisfaction that we have.
So basically, instead of just looking at the patient, you're looking at the entire spectrum of things that he's dealing with, including family,
Yes.
and that
Yes.
also obviously involves psychiatric support, taking care of the. And as you elaborated, the dementia is going to come up in a big way in our country because of the growing population that we have,
Yes.
and the geriatrician and the geriatric medicine specialist person is going to be at the center of all this. And as far as
Yes.
residency is concerned, it's just like you said, it's just not OPD. We do have full-fledged ICUs and HDUs where you do all the procedures, be it ICD insertion, be it intubation, be it pleural taps, be it ascitic taps, or be any other procedure that a person who's doing internal medicine is doing. You are just essentially doing you are doing exactly the same. It's not just an OPD.
Exactly. And in addition to that, we have all the peripheral posting that an internal medicine resident has. Even more, we also have rheumatology. We have rheumatology, hematology, endocrinology, psychiatry,
Every
all the postings, everything. There is basically not much of a difference, I would say. We have full-fledged academics that goes every day throughout the week, apart from Sunday, and we have CCR as well. So I don't see much of a difference. I see that there is much more than internal medicine per se. Since I mean, there could be a biased reply because I'm in this subspecialty, so I would obviously I would praise about geriatric medicine more. Okay.
So yeah, so we have elaborated about what geriatric medicine is and specialty and residency.
Mm-hmm.
What are the good institutes apart from AIIMS that you think of where geriatric medicine is being done as a specialty? Yeah.
So in India, it was first started in Madras Medical College. That's where geriatric medicine was first started. Then AIIMS Delhi followed. Then you have some of my seniors that graduated. They have started their own department. One has started in Raipur. Then there is one more of my senior who's currently the head in JIPMO. They have opened a geriatric medicine specialty there as well. So then you have fellowship options. Currently, we have fellowship options in geriatric oncology that's offered in CMC Vellore as well as in Tata. So yes, we have a lot of options. That's like the future aspect. Like after your geriatric medicine, what do you do? The thing is, we don't have a DM per se. One of the reasons why a lot of residents are on the fence to choose geriatric medicine. Okay, it's like internal medicine, but why don't you choose it? Because there is no DM. The DM options are intentionally not made as per my head. That is because this is a buffer time. We need more geriatric medicine per se. Usually you take internal medicine as a gateway to get into those subspecialties. So it is intentionally made not to add subspecialties at the moment, but in the future, as I just told you, we do exactly the same kind of work as internal medicine. We do attend all the peripheral most, in fact more. So we are more than eligible to get subspecialties. The only reason why we don't do that is because we need more geriatricians first. Then we can consider about that. Yes, in the future, I'm not talking about the immediate future. It is going to come up. Given that I showed you the building right now, it was going to take a lot of residents, and we need more subspecialties beyond the current level, MD level. Yes.
So geriatric medicine is going to come up in a big way, definitely, and for people who are considering a future, studies and academics, we right now have options as well as geriatric oncology in Tata in CMC, and later, maybe not in immediate future, but definitely in future, the DM also is going to come up in a big way. So that's there, and the good colleges, like you said, JIPMER, AIIMS Raipur, they also have started
Rishikesh.
They also have started their geriatric medicine program along with the established center that is AIIMS and Madras Medical College.
Yeah, there are few private institutes too, like Amrita, and I need to research more on the other private institute. But yeah, there are institutes like Amrita too. Yeah.
So let's assume you have finished your residency, and the final question for you is like you have finished your residency. What are the job prospects? Is it like yes. A lot of people are on the fence because of that? So can you just elaborate on that if you can?
Well, yeah, that is one good question that you asked. The job aspect. See, the thing is, right now, in other countries, it is considered as a subspecialty, right? Geriatric medicine subspecialty. In India, it's at an MD level. So what job aspects do they have? So most of us, they are taken up by a private setup, that is a corporate setup, with a very good starting salary. Some of my seniors, their starting itself is 2.5. at a private setup in the south and in other areas in the north as well. That is what it's like. Immediately, what do you do? Most people immediately they do SRship here to gain more academic experience. So SRs here are very involved in academics, especially because I jokingly say this, especially because they don't have a DM to worry about. They are fully involved and in role modeling their juniors. So as a personality, right, their academics, their own teaching skills improves. If let's say a person who is in internal medicine, who is a SR, he would be more, his mind would be full of clearing the DM exam. He wouldn't be too involved in the ward, which is not the case with the SR. So you're gaining a lot of teaching experience in that way, and you'd be a better, what do you say, better clinician. And after that, they apply to various government jobs. As I said, my seniors who are just 2-3 years elder to me, they are the head of their own departments in very reputed institutes, which is not the case with many branches. Since it's a relatively new branch, there are multiple options, and we are kind of like the pioneers, and geriatric medicine is still at its infancy as far as this country is concerned. So there is a scope for growth. And okay, if you're asking about the immediate future aspects, okay, there are some of my seniors that has cleared MRCP. They work in UK especially because NHS, right? There are plenty of jobs open for geriatricians because their population is on the negative growth rate. It's in the population, it's shrinking. Yeah. Yes, it's in the shrinking. UK, Germany, all those developed countries, and we are on that path as well. There are currently a lot of younger individuals. As I said earlier, by 2050, it's going to change. And most residents are going to take right now would be at their prime in 2050, right? So that is a very important thing. So it's like, who should take? You I mean, if you ask me, those people that are really interested in broad specialties, and they are okay with not doing a DM. They would like to sustain doing this for the moment. I said DM options are considered in the future, but I cannot say when. So they can consider taking this specialty. It's a broad specialty with multiple options within the country and abroad. Research opportunities. You have a lot of my seniors. They do research in oncology, some on aging, like healthy aging aspect. Cognitive reserve. There are so many interesting things that that is not run of the mill. It's all a very interesting futuristic aspect. I'm really excited. Like there are like a lot of things. One of the happy decisions that I ever took, and I'm very happy about it, is choosing this geriatric specialty.
So what I can sum up from my view is probably is the fact that if as far as huge job prospects per se is concerned, obviously you can easily go to a private setup and you have a decent salary even at the beginning from 2 to 2.5 L per month. And at the same point of time, since it's a very growing specialty, option of starting your own own department at a government setup.
It's versatile. It's
versatile. And if you're someone who's interested probably in pursuing the greener pastures of the developed nation, UK is coming up in a big way. NHS employs a lot of geriatricians, and at the same point of time, research is always there. And if not right now, few down the line, you can always go for a DM in the subspecialty that will definitely come up. So it's a very growing branch with a lot of future aspects, and you will be probably, by choosing it, not probably, you will be the few pioneers that establish it. In fact, what comes to my mind is, I don't know whether, I'm pretty sure you must know about him, he's in Dr. Rishabh Bansal. He's one of your seniors.
Yeah.
One of my seniors. He did his MD.
He's one of my favorites.
Yeah, exactly. Yeah. So he in fact chose geriatric medicine because of the reasons that you elaborated. One thing is he wanted to do a broad specialization. He didn't want to pursue a DM. He didn't want to crack another examination. That's what he told me at that point of time. And he said that geriatric is going to come up in a big way, and that's what has happened. He himself has started his own department, or sort of like that, back in one of the reputed private public setups in Jaipur. That is your Sandok Badura.
Yes.
Not wrong. So he is like sort of beginning it and everything. So that is, he took a decision there, and he's really happy. I see his Instagram posts most of the time, and that's what what people should also know. It's a growing branch. And by growing, we don't mean to discourage it. It's not something which is not established. No, it's
definitely, yeah.
Residency program is full-fledged. You have all your posting to the periphery, to all the branches, be it endocrinology, rheumatology, hematology, or that matter of fact. At the same point of time, you get a extreme hands-on appearance with your in the residency itself. And future options are good, mainly because you are going to essentially be one of the pioneers. You are the ones who are
Yes.
taking this field up, and it's only going to grow simply because we are an aging population, and simply because
Exactly.
we're an aging population and our demographics are changing rapidly as India becomes from a developing to a developed nations. Yeah. And
It's just not a GP practice. See, the thing is, the patients that come up with you, right? Since you're posted in cardio, neuro, and other stuff, like you know the drug interaction and stuff. Usually, when you go to a broad specialty, the geriatric older population. So when you take a subspecialty, for instance, you are focusing on one thing. See, learning is a practice of repetition, right? So I believe if you're in a subspecialty, you kind of lose touch with your broad specialty if narrowly focusing on. So
definitely,
if you're
I will.
in, yeah,
I'll attest to this as doing a DM, that I feel that my skills as a simply pediatrician are uh, slightly, maybe a bit not lacking. I won't say that I'm lacking any skill, but yes, the concept that rusting definitely does is happening. So, but that's a decision I took. I definitely wanted to become I wanted to do my specialization in pediatric oncology from the very beginning. I wanted to do it as a part of my intellectual and my academic curiosity. But yeah, as a broad specialty, I will definitely agree to the aspect that geriatric probably is definitely better, because you do stay in touch with everything.
yeah. So the thing is, since you're staying in touch, you kind of can you have this eagle's eye view, like, okay, he's taking all these drugs, okay, this is not good, this is not good, tuck, 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 tuck. You add in, or mostly we try to remove polypharmacy is what we try to do. It's like it's easy to add more medication. An elderly would come to you with 20 different drugs, a big list, which is a risk factor in itself for falls. Once an elderly falls, they already have this osteoporosis and other risk factors. They are bedbound, hip fracture, they are bedbound, and that's it. 6 months, 8 months, and they are gone. So we try to prevent that. How? First, you psychologically counsel them, try to reduce the drugs. How can you reduce drug without a knowledge? That is what we are trying to do. So I believe that staying in touch with your broad specialty in the longer run, and one of the real reasons why my chief didn't want a DM to happen at this point of time, is that I think that is the main aspect, and I believe it.
Right.
Hello? Yeah.
Thank you. Thanks a
Am I
lot.
audible?
Yeah, you're audible. You're completely
Yeah.
audible.
Okay.
So I'm just saying that I think this was a wonderful session that I had with you. Hopefully a lot of, at least the major doubts are being cleared of the aspirants who will be watching this on YouTube later. And I'm grateful that you agreed to this. So thanks to you. Thanks a lot. And
Thanks a lot, Aditya.
yeah.
I mean, I'm really you're one of my inspirations. As I told you earlier, it's like one of the I've been following you for a very long time. You're right from your Quora to Twitter. Your answers are so inspirational. Your posts are so inspirational. And one of the reasons why I chose AIIMS, especially Delhi, is looking at your pin post on Quora. Wow, AIIMS is amazing. I want to choose it. Despite the fact that I had options to choose internal medicine elsewhere, and I had the option of taking geriatric medicine. Okay, geriatric medicine, AIIMS. Let me choose it, AIIMS,
Thank
and I
you.
chose it. Yeah.
I hope that you made you are enjoying your choice. You're not regret. From your expression, it's obvious that you're not regretting. You're enjoying
No,
it.
I'm not.
Yeah.
Yeah.
So thanks a lot for those words. Hopefully, someone else will get inspired by these videos. And I actually want to say that you yourself are an inspiration. A lot of people
Okay.
I'm not kidding about that. A lot of people do ask me whether a foreign medical graduate can clear AIMS or something on those lines. So yes, you have your inspiration right in front of you. You can not just clear AIMS, you can be in AIMS Delhi, and you can practice, and you can be one of the pioneers in this field and other fields as well. So best of luck to all the aspirants who are watching this, and do consider geriatrics as a possibility. It's an up and coming branch, and hopefully uh, we have cleared a lot of your doubts about this field. So thank you.
Thank you, Aditya.